we're really trying to, at least at nView, and some of the things we're doing is try to move people past awareness. I think most people on the planet are very aware now that mental health issues are rampant and have been accelerated by the pandemic on many levels. And we're trying to move past awareness and really a call to action to start fixing things and start repairing the system, because there's just been this giant gap between healthcare and mental health care. In your opinion, I mean, what are some, why are some of the reasons you think our system is broken the way it is today? You've been around it a lot, certainly a lot more than we have. And what are some of the things you think we can do to start repairing it?
Mm-hmm. Um, well, I think there are a number of challenges, and at the same time, a number of reasons for optimism. When I started in this field about 20 years ago, it was next to impossible to get anyone with OCD good care. So when they would come visit me, essentially everyone was treatment naive. They hadn't had access to good quality of exposure and response prevention. At best, maybe they had solid pharmacotherapy. Now we're seeing that different. We're seeing a broader number of clinicians out there trained in this space. We're seeing increasing access to treatment, and then we're still seeing advances in terms of understanding illness pathology, but also how do we relate that to our treatments. So that's awesome. We're also seeing this secondary in many ways to COVID. This kind of increased frequency of telepsych, where folks are really appreciating the ability to do this from the comfort of their home without having to get childcare if they're an adult, or be removed from school if it's a kid. So lots of reasons for optimism. On the other hand, there are challenges. Stigma remains, and so that is a big thing for many folks. Cost is a huge barrier. While we may have achieved some successes within parity of mental health to physical illness, the reimbursement rates by insurers still tends to be pretty difficult. So for most providers, it becomes a sort of a choice or a challenge between kind of the way, do they accept insurance, but are have their rates dictated, and then have to process that versus a self-pay type arrangement. And so this really is sort of an issue there. One of the other challenges that persist is really the nature of training. So we're fortunate to have a field that has many, many brilliant clinicians across the range of medicine and psychology. But at the same time, there are often different ways of providing training that may or may not be linked to the illness or really robustly tested. So if you take the case of OCD, just because it's one I know, we know that there's a specific type of psychotherapy that works really, really well, but not everyone does this. And if you're looking at your insurance, it's often going to be a challenge to find someone outside of a medical center who's providing this type of treatment. And so we need to be mindful of in psychology and psychiatry, that we need to, in essence, provide the most effective treatments that have a robust evidence base exactly the same way that we would want to do so in any other discipline of medicine.